Welcome to this comprehensive guide on serotonin syndrome, potentially life-threatening condition that every healthcare professional and patient should be aware of. In this video, we'll explore what serotonin syndrome is, why it occurs, and how to recognize and manage it effectively. Understanding this syndrome is crucial, especially as the use of serotonergic drugs becomes more common. Let's begin by setting the stage for what makes this condition so important to recognize early. Serotonin syndrome is a serious medical condition caused by an excess of serotonin, a neurotransmitter in the central nervous system. This syndrome can develop rapidly and is often associated with starting or adjusting the dose of serotonergic drugs, especially when these medications are used in combination. The risk increases when multiple drugs that affect serotonin levels are taken together, making awareness and vigilance essential for both clinicians and patients. Serotonin, also known as 5-hydroxytryptamine or 5-HT, is a neurotransmitter that plays a vital role in regulating mood, sleep, behavior, and other bodily functions. It is produced mainly in the gastrointestinal tract but also in the brain. Serotonin is involved in processes like platelet aggregation, vascular resistance, and the secretomotor effect. Its balance is crucial for normal functioning, and disturbances can lead to significant health issues. Within the brain, serotonin is synthesized and released by neurons, influencing various regions such as the cortex, striatum, cerebellum, and limbic system. These pathways are responsible for mood, behavior, and sleep regulation. After its release, serotonin is removed from the synaptic cleft by a process called reuptake, which is essential for recycling and maintaining neurotransmitter balance. Disruption in these pathways can contribute to the development of serotonin syndrome. Serotonin acts on several receptor subtypes, labeled 5-HT1 through 5-HT7, each with distinct roles in the body. These receptors mediate a wide range of effects, from mood and cognition to vascular tone and gastrointestinal function. Understanding these receptors helps explain why serotonin syndrome can present with such a diverse array of symptoms, affecting both the mind and body. After serotonin has performed its function, it is broken down into 5-hydroxyindoleacetic acid, a process that helps regulate its levels in the body. The balance between serotonin synthesis, release, reuptake, and degradation is delicate. Any disruption, such as increased production or decreased breakdown, can tip the scales and potentially trigger serotonin syndrome. Serotonin is mainly produced in the gastrointestinal tract, specifically in the enterochromaffin cells, but it is also synthesized in the central nervous system. This dual production means that serotonin can influence both mental and physical health, affecting everything from mood to gut motility. This widespread presence is why serotonin syndrome can have such a broad impact on the body. Several classes of drugs can increase serotonin levels, either by boosting its production, enhancing its release, or inhibiting its reuptake and degradation. Common examples include SSRIs, SNRIs, TCAs, MAO inhibitors, and certain opioids. Even over-the-counter medications like dextromethorphan and supplements like St. John's wort can contribute. Awareness of these drugs is essential to prevent accidental serotonin overload. Drugs can increase serotonin through several mechanisms: by increasing its release from presynaptic terminals, boosting its production, inhibiting its reuptake, or decreasing its degradation. For example, drugs like phentermine and L-DOPA increase release, while SSRIs inhibit reuptake. Understanding these mechanisms helps clinicians anticipate which drug combinations might pose a risk for serotonin syndrome. Some of the most common drugs implicated in serotonin syndrome include SSRIs, SNRIs, TCAs, MAO inhibitors, opioids like Tramadol and oxycodone, and even certain anti-migraine medications. Over-the-counter cough suppressants like dextromethorphan and herbal supplements like St. John's wort can also contribute. It's important to review all medications a patient is taking to assess risk. Recognizing serotonin syndrome early is critical. The condition can develop quickly, often within hours of a dose change or drug interaction. Symptoms can range from mild to severe, and early identification can prevent complications. Healthcare professionals should be vigilant, especially when patients are on multiple serotonergic medications or have recently had their doses adjusted. Diagnosis of serotonin syndrome is primarily clinical, relying on a combination of symptoms and a history of serotonergic drug use. The most widely used criteria include Sternbach's and Hunter's criteria, which focus on specific neuromuscular, cognitive, and autonomic symptoms. It's important to rule out other causes such as neuroleptic malignant syndrome to ensure accurate diagnosis and treatment. Hunter's criteria are now widely used for diagnosing serotonin syndrome. According to these criteria, a patient must have taken a serotonergic agent and present with one or more of the following: spontaneous clonus, inducible clonus plus agitation or diaphoresis, ocular clonus plus agitation or diaphoresis, tremor plus hyperreflexia or hypertonia plus a temperature above 38 degrees C, and ocular or inducible clonus. These signs help distinguish serotonin syndrome from other similar conditions. Neuromuscular abnormalities are a hallmark of serotonin syndrome. These include tremors, muscle rigidity or hypertonia, and hyperreflexia. Clonus, which is an involuntary rhythmic muscle contraction, is particularly characteristic. These symptoms can help differentiate serotonin syndrome from other conditions with similar presentations, such as neuroleptic malignant syndrome. Serotonin syndrome often presents with changes in cognitive and mental status. Patients may experience agitation, nervousness, delirium, hallucinations, confusion, hyperactivity, hypomania, and hypervigilance. These symptoms can be distressing and may progress rapidly, so it's important for clinicians to recognize them as potential signs of serotonin toxicity. Autonomic hyperactivity is another key feature of serotonin syndrome. Symptoms include hyperthermia, hypertension, tachycardia, diaphoresis, and dilated pupils. These signs reflect the body's overactive autonomic nervous system and can escalate quickly, leading to severe complications if not addressed promptly. Among all the symptoms, agitation is the most common and often the earliest sign of serotonin syndrome. Patients may appear restless, anxious, or irritable. Recognizing agitation as a potential warning sign is crucial, especially in patients recently started on or adjusted to serotonergic medications. In severe cases, serotonin syndrome can progress to life-threatening complications such as seizures, coagulopathies, rhabdomyolysis, multi-organ failure, and acute kidney injury. These complications underscore the importance of early recognition and intervention to prevent irreversible harm. It's important to distinguish serotonin syndrome from other conditions with similar presentations, such as neuroleptic malignant syndrome and malignant hyperthermia. Each has distinct features and requires different management strategies. Careful clinical evaluation and a thorough medication history are essential for accurate diagnosis. For confirming serotonin syndrome, clinicians must rule out other potential causes of the patient's symptoms. This includes infections, metabolic disturbances, and other drug-induced syndromes. A careful review of the patient's history, medications, and clinical presentation is vital for making the correct diagnosis. Presentation of serotonin syndrome can vary widely, from mild symptoms like tremor and agitation to severe manifestations such as hyperthermia and seizures. Diagnosis is clinical, based on the presence of characteristic symptoms and a history of serotonergic drug exposure. Prompt recognition is key to effective management. Let's take a closer look at cognitive and mental status symptoms. Patients may present with agitation, nervousness, delirium, hallucinations, confusion, hyperactivity, hypomania, and hypervigilance. These symptoms can be subtle at first but may escalate quickly, so ongoing monitoring is essential. Neuromuscular symptoms are often prominent in serotonin syndrome. These include tremor, muscle rigidity, hyperreflexia, and clonus. The presence of these signs, especially in the context of serotonergic drug use, should raise suspicion for serotonin syndrome and prompt further evaluation. Autonomic hyperactivity in serotonin syndrome can manifest as hyperthermia, hypertension, tachycardia, diaphoresis, and dilated pupils. These symptoms reflect the body's overactive autonomic nervous system and can escalate quickly, leading to severe complications if not addressed promptly. Agitation is not only the most common symptom but also a key early warning sign. Patients may display increased restlessness, packing, or even aggressive behavior. Recognizing these behavioral changes early can help prevent progression to more severe symptoms. In severe cases, serotonin syndrome can lead to life-threatening complications such as seizures, coagulopathies, rhabdomyolysis, multi-organ failure, and acute kidney injury. These complications highlight the need for rapid intervention and supportive care to prevent irreversible damage. Hyperthermia and hypertension are common in moderate to severe cases of serotonin syndrome. These symptoms can progress rapidly and require immediate medical attention. Monitoring vital signs closely is essential for patients at risk. Neuroleptic malignant syndrome (NMS) is a condition that can mimic serotonin syndrome but is caused by different drugs, mainly antipsychotics. While both conditions share symptoms like hyperthermia and rigidity, their management differs. Accurate diagnosis is crucial for effective treatment. Malignant hyperthermia is another condition that can resemble serotonin syndrome, typically triggered by certain anesthetic agents. It presents with rapid onset of high fever and muscle rigidity. Differentiating between these syndromes is essential for providing the correct treatment. Cornerstone of serotonin syndrome management is the immediate withdrawal of the offending serotonergic drug. Most mild to moderate cases resolve within 24 to 72 hours after stopping the drug. Supportive care is essential, including monitoring vital signs and providing symptomatic relief. Supportive care is the mainstay of treatment for serotonin syndrome. This includes oxygen administration, intravenous fluids, continuous cardiac monitoring, and airway support if needed. Most patients recover fully with these interventions, provided the syndrome is recognized and treated early. In severe cases, more intensive interventions may be required, such as airway support or intubation. Intravenous chlorpromazine can be used in some cases to control symptoms. Continuous monitoring and rapid escalation of care are essential for patients with life-threatening manifestations. Cyproheptadine, a serotonergic antagonist, is the antidote of choice for serotonin syndrome. It is administered orally with an initial dose of 12 mg, followed by 2 mg every 2 hours or 48 mg every 6 hours as needed, up to a maximum of 32 mg per day. This medication helps control symptoms and hasten recovery in moderate to severe cases. Intravenous chlorpromazine can be used in severe cases of serotonin syndrome to control agitation and other symptoms. It is important to monitor for side effects and adjust the dose as needed. This intervention is reserved for patients who do not respond to supportive care and cyproheptadine. Most mild to moderate cases of serotonin syndrome resolve within 24 to 72 hours after stopping the offending drug and initiating supportive care. With prompt recognition and treatment, the prognosis is generally good. However, severe cases can be life-threatening and require intensive medical intervention. Awareness among clinicians and patients is key to preventing serotonin syndrome. Many cases occur due to a lack of knowledge about drug interactions or improper dose adjustments. Healthcare professionals must be vigilant when prescribing or altering serotonergic medications, and patients should be educated about the risks. Serotonin syndrome is often iatrogenic, meaning it is caused by medical treatment, particularly due to ignorance or lack of awareness among healthcare providers. Surveys indicate that many clinicians are still unaware of the risks associated with combining serotonergic drugs. Ongoing education and vigilance are necessary to reduce these preventable cases. Regular medication review is essential for patients on serotonergic drugs. Clinicians should assess all prescribed, over-the-counter, and herbal medications to identify potential interactions. This proactive approach can help prevent serotonin syndrome before it develops. Patient education is a cornerstone of prevention. Patients should be informed about the signs and symptoms of serotonin syndrome and instructed to seek medical attention if they experience agitation, confusion, muscle rigidity, or other concerning symptoms after starting or changing medications. Healthcare professionals play a vital role in preventing serotonin syndrome. By staying informed about drug interactions, monitoring patients closely, and educating both colleagues and patients, clinicians can significantly reduce the risk of this potentially life-threatening condition. Research continues to shed light on serotonin syndrome, its causes, and best practices for prevention and management. Recent studies highlight the ongoing need for education and awareness among healthcare providers. Staying updated with the latest guidelines is essential for safe prescribing. To summarize, serotonin syndrome is a potentially life-threatening condition caused by excess serotonin, often due to drug interactions or dose adjustments. Early recognition, prompt withdrawal of the offending drug, and supportive care are the mainstays of treatment. Prevention through education and vigilance is crucial. The take-home message is clear: always be cautious when prescribing or taking serotonergic medications. Be aware of the signs and symptoms of serotonin syndrome and act quickly if they arise. With proper knowledge and vigilance, this dangerous condition can be prevented and managed effectively. For those interested in learning more, numerous resources are available, including clinical guidelines, pharmacology textbooks, and continuing medical education programs. Staying informed is the best way to ensure patient safety and effective management of serotonin syndrome. Thank you for joining us on this in-depth exploration of serotonin syndrome. By understanding its causes, recognizing its symptoms, and knowing how to respond, we can work together to improve patient outcomes and prevent serious complications. Stay vigilant, stay informed, and prioritize safety in all aspects of healthcare.